Hi everyone, it's Brooke here. I am just going to be running through a couple of different series of movements following my live that I did for EDS Awareness Month. We're going to be focusing in on the 6 different principles, so there will be a series of videos. This first video is working on the pain linked in or related with hypermobility and how we're going to get your body to let go of the tension and to create fluid movement patterns to basically bring yourself into your body to experience and feel the movements. So the first 2 principles we're going to be focusing in on is breath and relaxation. So when you're ready, I want you to find a comfy position, whether it's with a pillow, your knees popped up over the top of a pillow. I'm just going to be laying here with my knees bent on my yoga mat. You won't need a ball yet. So laying on your back, knees bent, and just taking a moment to settle in. And when you're ready, I invite you to do a little bit of a body scan. We're not changing anything, we're just observing. We're observing any sort of tension or any sort of pain that's within your body right now. We're not changing, we're just looking. We're also looking at our breathing patterns. And when you're ready, what we're going to do is change our breathing patterns. So one hand's going to be on your chest, on your sternum, and then the other one's going to be hovering over your diaphragm, so it's just below the ribs, sort of in that gap. And what you're going to do is breathe in through your nose, feel your chest expand, and exhale through your mouth. And then with each breath, we're going to take it a little bit further. So breathing in through your nose, feeling your chest expand and your lungs press into the ground. So you're breathing into the back of your lungs. And exhale through your mouth. Now we're going to bring our breath down into our stomach. So some diaphragmatic breathing. Breathing in through your nose, through your lungs, feel your lungs expand, and then down into your stomach. And exhale. We're just going to continue with this for a moment, for as long as you're comfortable with, really. With each exhale, noticing the tension fall from your body. So we're feeling ourselves become heavier, falling into the ground, melting nearly. All the tension is falling from your body, so you're not clenching your jaw, you're not shrugging your shoulders, there's no tightness in your hips or your stomach. You're feeling that heaviness fall over your whole body. And that's our breath. So with the breath, we're basically letting go of the tension that builds up within our hypermobile bodies. Now with the breath, you can do it on your back, you could do it on your side, and you can do it on your stomach as well, wherever you're really comfortable, making sure that you are comfortable doing it. Okay, and then that feeds into relaxation as well. Another way to do relaxation would be a progressive muscle relaxation. So that would be doing a bit of a body scan and then starting with your toes. You want to notice the sensations of your toes. So squeezing, building that tension. And then with the exhale, you're feeling that tension fall. And then starting from your toes, moving up into your calves, your quads, so your thighs, your glutes, your stomach. And then all the way up to your head. Then the next thing that you can do is, especially if you have a lot of pelvic pain, which is really common in hypermobility, what you can do is bring your attention to your pelvis. Okay, so your pelvis as a whole. It's like the second brain of the body, some people say. So what we want to do is probably going to sound a little weird, but imagine yourself taking the contents of your pelvis out. So there's going to be no organs, there's going to be no nerves, no muscles, no tissue of anything. It's just bone. So eyes closed and you're visualizing just bone. Okay, and what this does is it essentially takes away that effort of movement. So we're going to go into a little bit of an anterior posterior pelvic tilt. So imagine you're sliding your hips up towards your ribs. You're connecting them with the least amount of muscular involvement. So it's a really small, gentle movement, and then you're relaxing. Okay, so we're teaching the body how to relax through a really small range of movement. We're teaching it that it's safe. And I want you to explore this movement. What does it feel like? What muscles do you feel moving? What sensations do you feel? And just stick with that for a little while, as long as you're comfortable with, really. Okay, now the next one that we can do is a little bit of shoulder flexion. So we're going to go into an arm roll. So as you inhale, we're lifting our energy up with our arms, coming up toward or in line with our shoulders. Exhale, we're controlled and letting them fall. So it is really slow and really controlled. Inhale, coming up. Exhale, slowly coming down. So again, we're noticing what these movements feel like. So as we come up, we can feel the weight of our arms fall into our shoulder socket. That is a normal and a safe feeling. And we're coming back down. Inhale up. And exhale down. So doing that for as long as you're comfortable with as well. And then another one we can do is progress that a little bit. So having our hands up over our shoulders again, and you can actually have like a TheraBand around your arms. And we're going to pull the TheraBand apart. We're noticing ourselves become heavy in our shoulders, so shoulders drop. So our scapula is flat, and then we're closing. So just noticing each feeling and sensation. They are normal. You are safe in this movement. Doing that for as long as you're comfortable with. And then the next one that I would always recommend, especially with scapular instability or shoulder instability and pain, is a protraction and retraction. So imagine you're reaching up for the sun and then you're feeling the heaviness of the sun fall into your shoulders. So you're not lifting your trunk, you're reaching, back stays flat, but shoulders sort of curve and then coming down. Okay, feel the heaviness, feel your, you'll feel a little bit of tension in your armpits even. So explore this movement. So we're moving throughout this range with no bracing. We're not bracing, we're not clenching our jaw, we're not holding our breath. We are relaxed through this movement. Okay. Another one that I would recommend is a 4-point kneeling pelvic curl. So slowly rolling to your side, pacing your postures, and coming up onto your hands and knees and taking a moment to just let your head catch up. There's no rush. And then similar to what we did on our back, we're going to do a little bit of a pelvic tilt. So kind of drawing your belly button in towards your spine, connecting your hips to your ribs, and then letting it go. Connecting ribs to hips, ribs to hips there, and letting it go. If you start to feel a little bit of pain in your wrists, what I want you to do is imagine the ground producing force up into your shoulders. So we want to make sure that that force going through all of your joints is straight. So you can shift your body forwards, see if that does anything, and backwards, or you can come off, roll them out, and then go back into it. So all of these movements that we've just looked at, they are working on integrating your mind with your body to help you feel safe and secure throughout that movement. So you're not bracing, you're not overexerting when you don't really need to be. So it's embodiment. So if you like this video and you want to hear more, we're going to be looking at stability or proprioception and stability in the next video. So keep watching.